So joining us today, we have our two very special guests with me, Dr. Jessica Rohr. She's a board-certified clinical psychologist with an additional certification in prenatal mental health, and our dear friend Mitali Paul, who is an administrator in the Department of Surgery at the Houston Methodist. So welcome, ladies, to Chai Time. We are so happy to have you here with us today, and I want to thank you both for taking the time off of your busy day to be here with us. And of course, we have Dr. Jessica Rohr, who is on air with us via phone. So before we begin the show, I'd like to first begin with a little quote. Being a mother is learning about strengths you didn't know you had and dealing with fears you didn't know existed. So with that said, today our topic will be on postpartum depression. Welcome, Dr. Jessica Rohr. Can you hear me?
Hello? I can hear you.
Oh, good. Okay. Welcome to Chai Time.
Hi, thank you so much for having me. This is just a delight.
Yes, thank you for being on air with us, and I hope you're feeling better.
Mitali and said, I don't want to bring this in the studio.
Of course. No, thank you so much for being on air with us. So I'm just going to start off with the first question, and it's a very generic question, but what is postpartum and what causes it?
Yeah, so I'm going to back out from postpartum depression a little bit, because that's the phrase that we use and that we've known well for a long time. I think most people at this point know about postpartum depression, or at least have heard of it. What we see is that there's actually more of a postpartum distress, and sometimes it looks like depression, but sometimes it's more anxious, a lot of checking, nervousness, worrying. Sometimes it can even be a postpartum PTSD, so some post-trauma symptoms related to a traumatic childbirth. So we're starting to learn more that what we used to just call postpartum depression across the board may actually be one of these other issues, even postpartum OCD. But what we know is about 1 in 5 women experience some form of mood disorder after delivery. We don't know exactly what causes it. We do know that there's a pathway that follows what we call a diathesis stress model. So what that means is a diathesis is risk. You have some sort of risk for it. And then your body, your mind encounters some form of stress, which is usually the pregnancy and the childbirth. It's very stressful on the body, even if it goes great.
Yes.
And some of the risks that we know of are definitely, if you have a history of depression and anxiety, you're at a higher risk. If it's your first child, which I think the mothers among us can understand that a little bit,
yes.
Your first child being more stressful than future children. If the pregnancy wasn't planned, which I'm always shocked by this, but about 50% of pregnancies are unplanned pregnancies, and that puts you at higher risk.
Oh, wow.
If you don't have good social support, if you don't have good partner support, if you had trouble getting pregnant, or if there were difficulties during the pregnancy, and then afterwards, if the breastfeeding is very painful, that can lead to some depression. And then, of course, financial stress, which is always related to depression.
Oh, wow. What can you elaborate some more of like the symptoms that are with postpartum? Yes.
Sure. So I like to usually talk about the difference between postpartum depression and baby blues, because baby blues are really common. I would say about 80% of women experience some form of the quote-unquote baby blues.
Is that the same thing as postpartum dysphoria?
That's another way to look at it. It's something, I have heard that phrase used before for baby blues. But it is, dysphoria is just kind of a sadness right after postpartum. And the difference is baby blues is generally milder. It just comes along with some weepiness, or postpartum dysphoria comes along with some weepiness, some thoughts of, this is really hard, did we make a mistake, what are we doing here?
Where's the manual?
Which is really normal. These are really normal thoughts.
No warranty period.
Exactly. But they go away. They go away usually by about 2 weeks, but typically I see closer to 5 days. It's that we feel is pretty directly related to the flood of hormones leaving your body after the baby does. But with postpartum depression, the way that we can start to differentiate is if it lasts longer than 2 weeks, and we see a lot more anger and irritability. We see a lack of interest in the baby, maybe avoiding being alone with the baby. Not really being hungry, even when you're breastfeeding. Not being able to sleep when you can. That's a big difference. That's what's people are always telling me, of course I don't sleep, I have a newborn. But if you can't sleep, even if someone else is holding the baby and they say, go, sleep. We see a lot of guilt and shame, not feeling like you're the right mom for this baby. And even in our more severe cases, thoughts of harming yourself or the baby.
Wow.
I think what's important to note here, and I know we'll talk about healthcare kind of disparities in a little bit, or I hope that we do, but many women only have a 6-week follow-up after they have their baby. And we see a lot of times symptoms of postpartum don't really get going until 3 or even 6 months after. So a lot of people can be missed if they have their 6-week follow-up and just keep going.
You would never think. I mean, I would think that it would just hit you right off of having the baby.
Absolutely.
But, I mean, that's interesting. So what is postpartum psychosis, and is it treatable?
Yeah, so postpartum psychosis is a very serious mood disorder. It's very rare. We see it versus like our 20% of women with postpartum depression. We'll see more like 1 to 2 out of every 1,000 deliveries for postpartum psychosis. So it doesn't happen a lot. When it does happen, though, it needs to be treated by a medical professional immediately. This is not something that we would say, hey, go to a support group.
Yeah.
You need to go see a physician immediately and get some help. That usually begins pretty much right away. We'll see that in the first 2 weeks. It's more common in people who had bipolar disorder before, but it also can happen in people who have never had any issues at all. What we'll see a lot is it looks like what we call a manic episode. So mom it seems like she has unlimited energy and it doesn't want to sleep, doesn't need to sleep. Or again, we'll see depression, but with some of these psychotic features. And psychosis typically means you see or hear things that aren't there. That's the hallucinations.
Oh, wow.
Or you have delusions. And a delusion is a belief that gets really, really stuck. So a lot of us have intrusive thoughts here and there. Oh, that car's going to pull into my lane. And then we can kind of say, okay, well, they may not, and then I can go on. Delusions are thinking that car is going to pull into my lane. I think they're doing it on purpose. I think they're following me. People are following. So it gets very stuck in times of stress. With postpartum psychosis, we do see more of the delusions than the hallucinations. There are some hallucinations, but we definitely see more delusions a lot of times about the baby. And this is where people get really scared that that the mother might hurt themselves or the baby. Mothers tend to hurt themselves much, much more. We only see babies getting hurt in about 1% of the cases of postpartum psychosis. So that's like 1% of the 1 in 1,000. But again, it can be quite dangerous, so people need to be treated immediately.
Wow. You would never think giving birth to a child would cause so many different side effects, if that's the right word.
And you can imagine how embarrassing it can feel and how shameful it can feel when the kind of the things that we learn are that motherhood is beautiful and perfect and amazing, and you had this baby, it's a miracle. And how ashamed women feel when it doesn't feel that way.
Yeah, I feel like that's why we don't talk about it.
Yeah, and I mean, I'm so grateful for you to be here and talking to us about it, because I have an 11-year-old, and I know there are some symptoms that I went through for the postpartum depression where I would just feel like crying. It was so overwhelming. And, the doctor just asked me, are you okay? But you're so ashamed to say anything. You're like, okay, maybe it's baby blues. It's just going to pass,
Right.
So, I hope the listeners who are hearing this know that, there are other women who go through it as well. Because I remember I just couldn't breastfeed and I would feel so guilty all the time, for, I think, a year or so, So,
Absolutely.
yeah. And Jess,
I also had postpartum depression after my first, and I'm a psychologist, and I still, when I remember I went to Texas Children's, which they have made a lot of strides in screening for postpartum depression, so that we can start to identify these cases sooner. But as a psychologist, I read this survey and I said, I don't want to talk about this stuff, so I just said I was fine.
Yes.
And we see that a lot.
Yeah.
People underreporting so they don't have to talk about it.
Yeah. So Jess, this is Mitali, and
Hi.
it's interesting you mentioned that sometimes you feel symptoms at maybe about 6 months, and that's what happened with me with my second one. I don't think I really felt anything, in terms of baby blues or what have you for my first baby, but then I was 9 months postpartum when I got pregnant with my second child, and had some life-changing events, kind of professionally, changing jobs and things like that. So I don't know if the environmental factors also influenced that, and also my body hadn't really recovered from the first surge of hormones and the first child, and then I was pregnant with the second one, but I didn't quite start feeling any of these symptoms, and it, for me, the way it showed itself was really anger and irritability and the inability to sleep. I bonded really well, but it was just, I was kind of in this zombie state, and it was for an extended period of time, almost a year. It took me several months to actually go talk to my OB about it. And, again, being in healthcare, being, quote unquote, health literate and educated, I still didn't recognize those symptoms. And, the guilt of like, why am I feeling like this? And, I had two beautiful babies, around me and just felt awful. And even now when I think about it, there's so many memories with my daughter, the first 6 months to a year, that I have blotchy memories because I was going through life like a zombie to a certain extent until I actually sought help and got medication and started feeling better and feeling the difference. So
I feel like as a mother or as a woman, you're just put in this box and you're supposed to not have other feelings or any feelings after you have a child, and your responsibility is to take care of that child and do everything right by them.
And be happy all the time.
Be happy, yes.
Super mom, but not have any feelings of guilt or anxieties or any of that, and you're just supposed to be this perfect specimen. And it's sad that we live in this society that women are, boxed in.
That piece that you just talked about is especially difficult in women who had fertility challenges and have finally become pregnant. Because you can imagine that women who wanted a baby so badly and went through, hundreds of thousands of dollars, pain, hormonal shifts to get the baby, that additional level of guilt of not having, a miraculous, amazing time. So we see some really deep depression in some of these groups because they think, what's wrong with me?
Actually, it's funny you say that. So just a little story about myself. I remember my husband and I, we were trying to conceive for 6 years, and we just could not. And we were at church, and I remember Layla, she's my best friend, and she was pregnant, and a couple of other friends of ours were pregnant, and we're all standing there, all touching their belly buttons. And I just turned around and I see my mom, and I started crying like a baby because I was like, why am I not there yet? Like all my friends are pregnant around me. Why not me? And it was just the toughest thing I have ever gone through. And I mean, of course, I'm very grateful that I have my two babies now. And but I remember that, and I feel like that was where I had the hard time. And then after I conceived, I don't remember. I just remember being really obsessed with my children.
She mentioned OCD, so that's why I was looking at you. I was like,
True.
Because Sasha was just sharing, Jess, that she said, the only thing I remember is I didn't want anybody to touch my baby or take her away from me. I just wanted to hold on to my baby at all times.
And I'm still like that.
Absolutely.
Yeah. So, can you have postpartum depression if you've had a miscarriage or fatal loss or even a C-section?
Oh, absolutely. So with a miscarriage or fetal loss, you absolutely can have depression, anxiety, OCD symptoms pop up. We wouldn't call it postpartum depression. We likely would call it major depressive disorder or even grief, because it's going to be a lot of grieving that loss. Again, there's all these things that we're bringing up that even as little as postpartum depression is talked about, fertility challenges and the psychological impact of that, and then the psychological impact of miscarriage or fetal loss or demise. We just don't have enough out there as much as we need. But so we would call that grief, or even complicated bereavement, which is the type of grief that comes along with a lot of guilt and shame. People have feelings like, I wish it were me instead. I wish I could have gone with them. And those things, those issues can be really, really tough to experience. But again, with support, people can definitely improve.
Yeah.
The mode of delivery postpartum depression can occur secondary to any type of childbirth, whether it's medicated or non-medicated. You'll hear me, I really try not to say natural childbirth, because I don't think it's fair. If someone grew a baby for 10 months and then we have the audacity to say that they didn't have a natural childbirth, I always say, if it didn't come out of your nose, then it was natural. So I say medicated or non-medicated, vaginal or C-section. And data's mixed. Whether elective C-section has higher rates of postpartum than vaginal delivery, or just the same, but we do know that emergent C-section has higher rates of postpartum depression, and we expect that that's actually a reflection of postpartum PTSD, because an emergent C-section, the definition of a trauma that leads to PTSD is a deep fear that you or somebody that you love is in fear of death. And that's what an emergent C-section is. I don't know if anybody's had one, but it's a very scary experience. You're not kept in the loop a lot of times because they're focused on saving your body, not your psychological health. There are a lot of things that can occur during it that make people feel quite helpless. So we do see really high rates of postpartum depression after emergency C-sections.
Wow. Yeah, both my kids were C-sections. First one was emergency C-section.
Mine too.
Yeah, so it's scary.
Oh, that's interesting. So can men suffer from this too? And if they can, then how is it different?
So they absolutely can. We actually see that about 1 in 10 men can have postpartum depression. It's a pretty high rate. I've
heard of men gaining weight with a woman being pregnant. Never heard of it.
Yeah, so the thing that we know about men in romantic relationships is that women tend to be the emotional support. So women receive emotional support from other women. In general, I know that this is not across the board, and it's not saying that men cannot support their wives, but men tend to receive emotional support from their partners. And that has a lot to do with socialization, the way that we're brought up, the way that men are brought up, and their ability to talk about emotions and how to seek help when they need it. And so about 1 in 10 men do develop postpartum depression, and the major risk factors are having had a history of depression, just like always, and the mom getting depressed. And so there are some theories suggesting that as mom is depressed and withdrawing and not able to kind of care and provide the support, that the husband then develops depression. Also just the major, the role changes, the redistribution of kind of attention in the home and things like that. And I mean, the rate of depression in men in general is about 1 in 20. So this is definitely double. I mean, this is definitely an issue. Again, another one that we just don't have very much attention paid to it. It looks a lot like depression in women. We do see more irritability, indecisiveness, and a lot of emotional numbness or blunting in men.
Oh, wow.
Yeah.
I just feel like women are such... I can't say that word, but we're just so awesome.
We're troopers, I think. Resilient.
We are. I mean, all of
a man with a cold equates to a woman in childbirth.
That was a perfect example to sum this up. Yes, I love that. That's so true. I mean, we can just, we're dealing with so much, and yet we're cooking a hot meal and taking care of a baby and going to work, and we're just
we are. But I also do argue sometimes that doing so much drains us so much more, and we do a lot of that because we have to. Because if we don't, who will?
Yes.
And sometimes we have to just drop it and see.
Yeah.
Just see what happens so that we can put our own oxygen mask on before we put it on other people.
Yeah.
That's why they say self-care is so important, and we tend to just skip
And
on
it's
that
funny,
part.
you know, you said that about the oxygen. I still hear that in the airplanes, and I'm like, in my head, I'm like, no, it's gonna go on my child first, you know. So yeah,
I know.
mentally we're just trained like that. I think.
Yeah.
Exactly.
Yeah.
Exactly.
Well, let's put a hold on just for a second. We're just going to go on a quick break, and then when we return, we'll continue this fascinating conversation with Dr. Jessica Rohr and Mitali Paul. So you're listening to 99.5 FM. We're going to take a quick break, and we'll be right back. Welcome back to Chai Time here on 99.5 FM. For those of you who have just tuned in, we are in conversation with Dr. Jessica Rohr and Mitali Paul on prenatal depression, postpartum depression. Sorry. So when we went on break, we had a listener that actually had a question.
Yeah. So this is a question for Dr. Rohr. How are postpartum depression and body image, are they related?
Absolutely. So we don't know quite yet which came first, like the chicken or the egg. But we know that body image dissatisfaction and prenatal and postnatal depression are significantly linked. And I see this play out a lot. I was thinking about a group that I led for women, and one woman said, you know, I would look at myself in the mirror and just not even recognize my body. And this was a feeling that a lot of the women had and had never voiced. Again, because there's this sense, you know, anytime you say, I don't like the way my body looks, what's the natural reaction? Oh, but you used it to carry a baby. You should be proud. You should be this. You should be that. So especially in a world where we are really socialized to think that we have to look a certain way all our lives. And then to spend all of this time and energy, you know, creating another human, it's not. It makes total sense that wouldn't just completely eliminate the worry over our body image from our minds. And so, for some people, to focus on weight. For others, it's more on shape. For others, it's more on fitness level. But it is absolutely something that happens and can again feel really shameful. It ties in a lot with identity. There's this idea in the literature of just like we have an adolescence, we have a matrescence when we become a mother, where it's really like challenging us to look at our body changes, just like in puberty. You know, the things that are important to us change. The way we think about ourselves and other people changes. And so it is, I mean, it's a time of great upheaval. And if you're kind of alone and trying to navigate that, it can be really difficult.
Yeah.
Wow. It's a whole lot.
It's a lot.
Learning so many new terms.
So many new terms. Exactly. Yes.
As we go through these conversations, my eyes just keep getting wider and wider, Dr. Jessica. So, do you see disparities in women of different socioeconomic or cultural backgrounds in assessing care?
Oh, sure. So non-white women and women of lower socioeconomic status are just as likely or even more likely to develop postpartum depression. So much of our research is what's called WEIRD, WEIRD. That stands for Western Educated, I can't remember the rest of it. Weird research participants. I'm Googling it really quickly. Western educated, industrialized, rich, and democratic societies. And usually, like from a psychology perspective, that also means white. So a lot of what we know or think about postpartum depression is generalizable mostly to white women. And a lot of times these studies are being done by academics, and so what's accessible to them is people who live in cities with colleges, with universities, and they tend to be more educated, higher socioeconomic status. There was a recent review out of India that demonstrated that about 26% of South Asian women develop postpartum depression, which is quite a bit higher than our current estimates that wash out race completely. So there's a lot that happens in the healthcare system that makes it difficult for people to access mental health care. We know that people who are non-white women and women of lower SES, which is socioeconomic status, they're less likely to access care. I saw a study that suggested that about half as likely to go and receive medication for depression, to get follow-ups on that medication, and to develop kind of continuing care.
Yeah.
And we have all of these different ideas of why. I mean, there are some really valid trust issues with healthcare organizations for non-white women and or for women of color. There's a lot of judgment from providers towards women of color. And one of the things, and we kind of alluded to this earlier, but one of the major reasons that women don't speak up about what they're dealing with is the fear of having their children taken away. And CPS disproportionately, they have higher reports of higher numbers of reports are made against Black women, not against, that's a strange way to say that, but for Black women. And so, a lot of the things that people deal with postpartum are thoughts of, I'm not the right mother. I don't want to spend time with this child. I mean, these are very scary things to tell somebody who may judge you for saying it just because it's white.
Yeah.
So, there's definitely some disparities.
Yeah. So, how do we tackle the barriers to care?
So, a large part of my job is research. And based on what I've learned, I believe that we have to start at the beginning of the pregnancy journey, not trying to wait until things happen, but get in there at the beginning and start exploring some of these factors that lead to increased risk and act preventatively. Western culture is so siloed and so individualized. It's very much, you're in it for yourself, get it together, bootstraps, all of that. And that is hugely problematic for a process of pregnancy and childbirth that's historically, and in other cultures still, made much better and much healthier through a communal approach. Having a ton of people around. There are different cultures that do sort of a forced,
almost a quarantine of sorts.
Yes, yeah. So there's like La Cuarentena in Mexico. Yeah. I believe there's some Indian cultures that do
yes,
like a 40-day
in southern India, there's some cultures where 45 days after, and I heard this from someone, for 45 days after childbirth, the mother is actually given special meals and given baths and massages and things like that, where you have the postnatal care. But interestingly, Jess, I mean, even with communal cultures, when it comes to mental health, so, physically, you potentially, physically and socially, you could potentially have the support system and have people around you to help with, chores and taking care of the baby and just helping you recover physically. But there's still so many barriers to where you would have those conversations about, what emotions are you going through? And do you need help mentally? Because you could be surrounded with people willing to help you, but you can't still express yourself or talk to someone about what you're going through and the emotions, the barrage of emotions.
It's either shunned upon or it's just like, you don't know, it's just a feeling, it'll go away. Like you're fine.
Yeah. And the times when you do voice it, you're judged or shamed, and not intentionally or maliciously, but it's really more, why do you have to feel that way? I mean, look at your beautiful baby. Your baby's healthy. You're healthy. You have the whole family to support you. Why are you feeling the way you are? And so that ends up making people not want to talk about it.
Feel and guilty. Then why am I feeling this way?
And seek help. Absolutely. So how do you kind of work through some of those barriers and improve education? The other thing that, I know you mentioned prevention. And when I think back about my experience, I had a great OB, and but we never talked about postpartum or mental health or anything. It was really me reaching out to her after several months to say, listen, not feeling like myself. This is what's going on. And that's when she recommended, really low dose of postpartum medication. And that's how I started off. But there was no conversation whatsoever where either before or after childbirth about the mental health piece of it. And again, I mean, we would talk about a lot of things. She knew I was in healthcare, and we would talk about a lot of things, but never talked about my own mental health. So how do we as women, one, advocate for that for ourselves, and then how can we, as a society, kind of impact that where we have more prevention, we have more OBs, asking women about it and talking about, or at least saying, hey, if you feel XYZ, or these are some of the symptoms that you need to be watching out for, seek help, or, this is what you can do. What are some resources that, we could share with our listeners about how they could advocate for themselves more?
Absolutely. And what you're talking about, this is something I'm very interested in, is building a kind of a collaborative between OB, mental health, and community leaders, whether that's like religious institutions, just people in the community that are trusted, to create more opportunities for education about these issues, and for having kind of partner advocates in the process, because sometimes it's really difficult and scary to ask those questions for yourself, but if you've got a close friend in there, she'll go to bat for you. So just kind of making it, again, more of a collaborative process. One resource I really, really love is called Postpartum Support International. This is a big organization that provides a lot of training for providers, but also a lot of resources for women that are struggling. They have just some kind of basic information about all of the different postpartum illnesses. They have a lot of virtual support groups that are free to join. There's a helpline that you can call and talk to them. How I don't know what to do. I don't know how to talk about this. I do think it's going to be incumbent on us as a community, because what I hear over and over again from OB is that they want to help. They don't know where to send people, and they don't. So it's almost like they don't know what to do if something does come up. And so we really need to focus on creating more opportunities and more resources for people to use when they do need help. The Postpartum Support Internet is postpartum.net. This is where I got my additional training for perinatal mental health. There's a support group in there for South Asian moms. It's every Monday at 3 Central. It's just got a good set of resources for people.
I feel like this information should be shared at the time of visit with the doctor at 6 weeks, right? Because a lot of women are still afraid to even talk about this or even share with the doctor.
Agree.
Yeah.
And that's actually what I'm hoping to do at Houston Methodist, is to create a kind of education pamphlet, just to have it all to OB clinics and to just have that available.
Yeah. And, potentially even have a caregiver's support network, because a lot of times the woman herself may not be able to recognize those symptoms or even understand, I need help, because you're so overwhelmed.
Yeah.
But it's the partner or, the support system. It could be the caregiver that realizes and sees and recognizes those signs and symptoms.
And in other countries they do, like I know in New Zealand, my sister-in-law gave birth, and so they have not a nurse, but they call her a doula who goes in after the baby for a couple of months to check on the baby and the mom and provide that extra support.
I wish we had resources such as this.
My sister actually used a doula.
Oh, okay.
She did.
Okay.
That's interesting. Here in the States.
In Seattle.
Dr. Rohr saying something.
Oh.
Yes, Dr. Rohr.
Oh, so I was thinking about the barriers to care, and again, in other, often used in Black and other communities, doulas and midwives are often a part of the whole process.
Okay.
But again, because our managed care and all of those are so focused on this kind of Western white society, those are covered by insurance. but there's a lot of research suggesting that having that advocate through the process, and then like they have night doulas who come and help you sleep, and so there are definitely, you know, there's this sort of stratified levels of risk that is sort of these deeper levels that we can't really fix, but we can speak to and kind of discuss. But then there's some immediate stuff like lack of sleep. That's an absolute predictor of depression. So I do think kind of thinking more about some of these practical risks and practical risk factors and ways to address those. Like going back to prevention, one of the major predictors of difficulties postpartum is not having good prenatal care at all. Yeah. And things that get in the way of that are lack of transportation, lack of childcare, not being able to have time off work. So there are some really practical things that could be done to make these pieces easier.
I think in places like New Zealand, they also give you 6 months to a year of maternity leave.
Yeah.
I mean, as opposed to here, right?
That's another topic for discussion for another. Like, don't get me started on that. It's another show. You know, the fact that we get the fact that we get FMLA for, you know, 3 months and you're expected to come out of work, and that FMLA comes.
Is the 3 months as if you've had a C-section, right?
Either way. And I mean,
Medicaid.
Go ahead.
People have Medicaid. It ends 60 days after the childbirth.
Yeah.
You know, there's just a lot of factors at play here.
So, Jess, you talked about some of the, you know, risk factors in terms of if you've had difficulty conceiving or, you know, had fertility issues, then those contribute or could likely lead to, you know, postpartum different conditions postpartum. Are there any other factors that could contribute to it that, you know, people should be aware of and kind of watch out for, you know, more from a prevention perspective?
Yeah, so I like to think about some of the factors that, you know, like I said before, there are some that are just there. Like, I could not help that I had a history of depression before I had my first child. Like, I can't do anything about that. But there are some that we think can be mitigated, and again, with, you know, an ounce of prevention. So one of those factors is having a very rigid idea of how the birth will go and what behaviors are going to engage in as a new mother, rather than a more flexible idea of the kind of more important goals. So breastfeeding, again, is an example. I think this got brought up earlier. It was definitely a factor in my depression. A lot of people say, I'm going to breastfeed for, let's say, 6 months after. And they just kind of, that's their sort of rigid idea. That's what good mothers do based on all of the, I'm not going to call it propaganda, but propaganda that we hear. and that's it. And then they kind of go on, not realizing that breastfeeding can be extremely painful. Some people experience what's called DMERS, or dysphoric milk ejection reflex syndrome, which means when your milk lets down, you have a wave of dysphoria. So breastfeeding itself can actually cause sadness. It's a very difficult experience. And so if you have based your idea of being a mother on breastfeeding rather than having a healthy, nourished child, that's going to really impact that, right? So I really encourage women, when I'm seeing them in the pregnancy period, to think more about what is their long-term goal for their children, what are their values for their parenting, versus what are the behaviors that you feel like you have to engage in order to be a good parent. So again, thinking through like the childbirth, I want, a lot of people say, I want a vaginal birth. That's fine. Sometimes that's out of your control. And so you can say, that's what I'm striving for, and at the end of it, I want to feel like I advocated as much as I could for what I wanted, et cetera, et cetera. So just sort of thinking through what we've decided for ourselves with the pregnancy, the childbirth, and postpartum, and then really think of it more as what are my core values for my family, and are there multiple ways to reach those values?
Wow.
Lots to think about.
A lot. for sure.
But some great insights and some great ideas and thoughts, in addition to planning, your diaper pails and cribs and everything else, but, just preparing and thinking about, your own mental health and some very interesting conversations to have with your support network and your partner.
I was just thinking, like, when I was going through it, this show would have really helped me. Because seriously, because it's crazy that you can go back in moment right away, feel those emotions, So yes, it's I think the show is very helpful. It's very helpful because so many mothers go through it and they're trying to take care of another human, but they can't seem to take care of themselves. That's so sad that as a society we don't put more effort into it, right? Yes, we have the whole medical community, but what about at home? They just keep saying, oh, you're supposed to be okay, just feel okay, it's okay, it's gonna pass. But no, it doesn't,
It's not a cold.
It's not a cold. So yes.
No, and that's why conversations like this are so important. So thank you both for allowing us to come and talk about it, because this has been something I've been passionate about since I experienced it and felt crap about it. And, it's important for.
Could I speak briefly about treatment?
Sure. Yes, please.
I know we don't have much time. I just wanted people to know that this is a highly treatable issue. If you go untreated, it can last for months, even years. I've seen people with 4 or 5-year-olds who feel that it never went away because they never talked about it. But if you are willing to talk to a partner, talk to a friend, get something set up. Somebody before mentioned postpartum medication. There's medications that are very safe for breastfeeding. So you can continue to breastfeed while being on medication for postpartum depression. Support groups or therapy groups so that you can meet other people who have sort of similar things going on. And then individual therapy. This is the bulk of what I do. So it is absolutely treatable. There are evidence-based therapies for it. And it can get better quite quickly once you have the ability to just even letting go of that shame of somebody saying, it's okay, you're not alone. That's actually, you're still even though you feel that way.
Yeah. The key word is letting go of that shame. I like that. That's so true. Yeah. Wow, the time just flew by. I want to talk more. Thank you, Dr. Jessica Rohr, for being on air with us, and thank you, Mitali.
Sure.
I mean, we really appreciate these, and I feel like this is the reason why we do this show, is to spread awareness and to talk about things that aren't talked about and are still shunned in our community and elsewhere. So I'm very thankful to the both of you for being here with us today and talking about this very important topic. Listeners, we appreciate you every week for tuning in with us. Don't forget to tune in next week here on Chai Time on 99.5 FM with your Chai Time girls. Remember, we are here on Mondays at 11 a.m. I don't know why I said 9. Thank you again, listeners. We will see you next week, same time, same place.
Thank you.
Bye. Thank you.
Bye.